So one of the things we talked about in live class was the difference between objectives and goals. And basically objectives are just smaller, more realistic, broken down steps to get to the overall goal. And I know that in the field of applied behavior analysis, especially when we're creating treatment plans, writing reports, updating programs, we talk a lot about goals, but we rarely talk about objectives and what those look like for each client. And I know also it also depends on the platform we're using, which makes it either easier or harder to kind of think about the idea of an objective. So, for example, if we're using Central Reach, they don't have an auto population for objectives with like behavior intervention plans, right? With behavior reduction goals. Versus Rethink, they have the option to either measure something and set a goal or measurable objectives to reach the goal. Just because it has that option doesn't necessarily mean that BCBAs know how to use it. One of the biggest things I see, especially when it comes to the behavior reduction section, is that BCBAs are creating these very large, big jump, quote unquote, goals, but they don't have smaller objectives to reach the goal. So, for example, if a kiddo is engaging in tantrums for 45 minutes per instance on average, I will see a reduction goal of 0 minutes per instance across 10 consecutive sessions, right? So to get a kiddo from 45 minutes to 0 minutes per instance is not timely, right? It's not an appropriate timely goal. And when thinking about SMART goals, right? So a part of SMART goals is reasonable in time. And the challenge with these big jump goals is that now the goal is in place for 6 months, a year, 2 years, 3 years, because the BCBA hasn't set those smaller measurable objectives. So some of the biggest feedback I give to my BCBAs when I'm doing those quality assurance checks is to think about the reality of reaching this goal and how we can break it down to smaller goals. So typically if I have a kiddo who's engaging in, say, head banging on average of 50 times a day, right? My goal isn't going to be 5 times or less per day. I'm going to have the first objective of maybe 20 times or less per day or 30 times or less per day. Once we hit that, systematically reduce it so that we're meeting the objectives and then also systematically decreasing to the ultimate goal, which is 0 times per day. So I know we also talked about the intradimensional and interdimensional. So intradimensional is within the same dimension and interdimensional is between different dimensions of stimuli. And when I think about this, I mostly think about DTT trials and when we're putting stimuli against what we're putting the stimuli against, right? So if I have a level 3 kiddo who's level 3 social skills and language skills according to DSM-5, and we're teaching them to discriminate between animals, right? So intradimensional is within the same dimension, right? So that may be a pig versus a cow, right? Interdimensional may be a cow versus a tissue, right? A random stimuli that's outside of that dimension. So it may be easier for the kiddo to discriminate between the interdimensional because they're not within the same dimension. So we typically start with the stimuli that we want to target. So say a cow or a pig if we're focusing on animals, and it may be a random object. So it's more likely for them to select the correct object. Once they progress towards the goal, which is accurately selecting the stimuli that we're wanting or the stimulus that we're wanting, then we may go to interdimensional. Right now we're putting a cow versus a pig or a cow versus a horse. And unfortunately, I just don't know if a lot of BCBAs are kind of trained on that interdimensional and interdimensional. So a lot of times when I'm going over these QA checks and I'm seeing like a very early learner and they're just starting ABA, and I see the BCBA trying to get them to discriminate between like a cow and a pig or a red block and a blue block, they may not be at that level yet. So I always suggest like an interdimensional model where you're putting it against a random stimuli and even non-preferred stimuli, right? Because there could be random stimuli that are reinforcing and then they're likely to touch that, and that's going to kind of mess up the trial in general, right? So being strategic about how you're setting the stimuli up and placing them up against each other. But I think this all kind of falls under the lines of adequate goal setting and setting SMART goals. And as many goals as we set in the field of ABA, a lot of times I don't hear the word SMART used enough. In the QA checks that we do have that domain as like, is the goal smart, right? Is it attainable? Is it measurable? Is it reasonable in time? And I think as BCBAs, we really need to focus on making sure goals are smart and also developmentally appropriate, right? Like I see goals for a 5-year-old that may not be appropriate for his age. So if a 5-year-old is having tantrums, say 10 times a day, and the goal is for the 5-year-old to have tantrums 0 times per day, right? Is that a developmentally appropriate goal for a 5-year-old? Most likely not, right? I don't know any 5-year-old that never cries, never whines, never has non-compliance, never has tantrums. So I try to challenge my BCBAs to think about the age, think about a typical 5-year-old. Do they ever have tantrums? If so, what is a typical amount of tantrums that they have? Maybe once or twice a day, right? Maximum. So a goal that says 0 times per day may not be reasonable or attainable. However, a goal that says 2 times a day or less may be more attainable and developmentally appropriate for that child.